speak to everyone out there who maybe just got this vaccine or their kid did, especially maybe their daughter. These are the symptoms: severe headache, abdominal pain, leg pain, shortness of breath within about 2 to 3 weeks. Sanjay, not a fever. That's not listed as a concerning symptom. That's important for folks. A lot of people get fevers after vaccines. What should those people do? And why women? Why is this all women, young women?
Yeah, so there's a couple things in what you just read. First of all, there are different types of clots. The clots that were of these great concern, the one that I just showed the image of, are cerebral venous clots. But there have been reports of clots in some of the deep veins of the legs, known as DVT, and even some clots in people's vessels around their abdomen, their abdominal vasculature. So you have different symptoms in those cases. I think I want to emphasize again, I know that there's probably a lot of people listening who are just understandably going to be worried if they've just received this vaccine. This is still rare, but if you do have these side effects, you should talk to your doctor about this. And right now, just even our reporting, this is all unfolding real time. Clinicians are hearing about this for the first time as well, so their antennas are all going to have to be raised for patients who've had this vaccine, who may develop any of these symptoms, and have a plan in place in terms of what they want to do with this, how you diagnose the clotting, how you might treat it. Some of them may not need treatment. Some of them may just resolve on their own. But all, we are seeing medicine sort of unfold real time here with this particular issue. The clotting itself is not a new issue. We see people developing spontaneous clotting, and that was the issue in Europe when this AstraZeneca association was being sort of evaluated. Is this sort of just normal background clotting, or is this something really associated with the vaccine? It can be hard to parse that out if these are very small numbers. But I think that's really the message right now. Understandably, you would, if you have concerns, if you have any of these symptoms, it's unlikely you will, but if you do, you've got to talk to your doctor about this.
And just also remember, this is 6.8 million doses out of 189 million doses of vaccine that have been administered. That number on your bottom right hand of your screen, more than 180 million doses of coronavirus vaccine that have been administered are Johnson & Johnson at all and don't have this same concern. Dr. Offit,